Okay. Good evening. Today I'm going to talk about cardiovascular system and particularly the arrhythmias. One of the most cause of sudden deaths are arrhythmias, especially ventricular fibrillation. I'm going to talk about the following. I'm going to talk about, in this lecture, we are going to talk, I will just begin with one, anatomy of the heart muscles, and I'm going to talk about electrical responses, that is action potential. I'm going to talk about action potentials. I'm going to talk about heart blocks. I'm going to talk about reentrant phenomena. I'm going to talk about ventricular arrhythmias. I'm going to talk about atrial arrhythmias. And before we talk about, let us begin with anatomy of the heart muscles. The heart muscles, there are 4 chambers in the heart, in our hearts. 4 chambers in our hearts. These 4 chambers are the ventricles, you have the atria, and these are the atrium, let us say left atrium, and this is right atrium, and this is left ventricle, and this is right ventricle. Now, when the atria contracts and they push the blood into the ventricles, and the ventricles push it into either the lungs and to all parts of the body. Now, these are the 4 chambers of our hearts. And we are going to talk about the conductive system, the electrical wires that are responsible for our for the heartbeats. We have in our hearts a group of specialized cells, neurons called sinoatrial nodes. Sinoatrial node. And here we have arterioventricular nodes. And here we have what they call bundle of His. Yeah? The bundle of His. This is the electrical wire. We have what they call the bundle of His. This is arterioventricular AV node. And here, this is the right bundle brain. Right bundle brain. And this is the left bundle brain. And this is the posterior fasciculus. And so this is the electrical wires. And when action potentials or the stimulus starts in the AS node, the impulses spread from the atria, and they converge in the AV node, and from the AV node impulses travel down here through bundle of His. This is called bundle of His, bundle of His. And this one, there is the Purkinje system here down in the walls of the ventricle, Purkinje system, and you have this one, left and right bundle brain blocks. So this is the simple anatomy of our heart and our conductive system. Now, when you stimulate the heart muscles, what happens is the ionic changes, ions, sodium and potassium, calcium, are the ones responsible for our action potentials. When the sinus atrium and sinoatrial node is the fastest, is the first maker in our hearts. It is the fastest place where electricity is initiated than any other part in our hearts. So when a stimulus is applied to sinoatrial node, an action potential is initiated, meaning sodium influx. Sodium moves from extracellular compartment into the interior of the cells, and this action is called depolarization. Whereas at the same time, calcium slowly moves in as well into the cell interior, and this also adds to depolarization. The interior of the cell interior will be positive, and the cell exterior will be negative. Then after that, after calcium, this one will be followed by potassium efflux, meaning potassium moves from the cell interior to the exterior, and a wave of depolarization will be propagated. Interior cell membrane, positive, negative, positive, negative, positive, and this one will be propagated along the cell membrane. And after this action potential muscles will contract. Now, the wave of action potential, the wave of action potential looks like this. This is 0 and this is 200 milliseconds. Now, depolarization start here from 0, depolarization, go, then down, then a plateau, then down. This is called phase 1, then phase 2, phase 1, phase 2, phase 3, phase 4. This phase 1 indicates depolarization, and phase 2 also as well is a part of depolarization, but is due to calcium influx, and this one is due to sodium influx, also calcium efflux, and we have this one is due to potassium efflux, and this one is influx. So this is the curve of the action potentials as seen in experimental animals. Now, I'm going to talk about arrhythmias, and why are arrhythmias important? I said because arrhythmias are the most cause of sudden death Our hearts normally beat like this. Supposing these are the atria and this is the ventricle. They do it like this. Or the crocop sound. When you have a heart working like this, what happens? There will be no time for the ventricular filling, and the stroke volume and cardiac output will be reduced. And when you have having ventricles that are contracting like this, cardiac output will be reduced, and you will have no circulation. That's the reason why I'm going to talk about arrhythmias. In ECG, our ECG looks like this. This is called P wave, and you have the R wave, and you have the S wave, and you go down, you have another wave, T wave, and you have the U wave. This is how the ECG looks like. Now, in this ECG, this is the Q, this is the whole of this, Q, R, S complex. This is the P wave, and this is the T wave, P wave. Now, in arrhythmias, and arrhythmias occur because of the abnormal conducting place, loci in our hearts, other than sinoatrial nodes. So, when one of these happens, then you have the blocks, heart blocks. Say, for example, heart blocks, when one of these conducting system is disturbed, for example, here, you block here, or you block here, or there's no conduction here. This is what are called heart blocks. Heart blocks are of three types. Type 1 is called first degree, type 1. Impulses are conducted from sinoatrial node and into the ventricles. Type 2, some impulses make it to the ventricles, where in a ratio 2 atrial beats, 1 ventricular beat. And the PR interval, this one, will be long. Prolongation of this interval, PR interval. Type 3 is a complete heartbeat, and impulses, no impulses, are propagated to the ventricles. Type 2 and type 3, type 2 is called Wink-Back phenomenon. So type 1 and type 2 are not dangerous, but type 3 may need an implant, pacemaker. Another condition, when impulses are conducted somewhere else in a place other than sinoatrial node, then this one will cause a condition called reentrant phenomenon. And reentrant phenomenon causes atrial fibrillation and ventricular fibrillation. What is reentrant? Supposing an impulses are generated somewhere, not the sinoatrial node, somewhere here. There will normally be, and you have a block somewhere here, say block. Impulses will normally be propagated into the whole of the cardiac muscles. And when this block is relieved, then they will go back and the cycle will repeat. This reentrant phenomenon is called circus movement. is the reason why we are having atrial flutter, atrial tachycardias, and we have the ventricular tachycardia. So one of the ventricular tachycardia, atrial tachycardia, let us talk of atrial tachycardia, is atrial fibrillation, atrial flutter. The heart rate in this case is about 200 to 350 beats per minute. In ventricular cardia, the point of this one is within the ventricle itself. The point of initiation of impulses is within the ventricles itself. So it causes ventricular fibrillation. Ventricular fibrillation looks like this. For example, ventricular fibrillation. Say torsat. Torsat, the point is one of the ventricular tachycardias. Look like that. Torsat, the point is. And we have ventricular fibrillation. The heart is doing like that. Ventricular fibrillation. And this is very serious, most dangerous type of arrhythmias, and is the cause of sudden death in most cases. Another condition, why are arrhythmias very serious? I said because when you have a heart fibrillating like this, you will have a reduced stroke volume, a reduced cardiac output, and you have myocardial infarction, ischemia, and your heart will stop. So that is the reason. The other condition that I'm going to talk about are the electrolytes abnormalities. We have sodium and potassium. Hyperkalemia is more dangerous than hypokalemia, and in this case, you will have a prolonged ST segment, and you will have Q segment. And in this case, Q are present in some of the leads, and that's why there is what they call Q infarction, Q myocardial infarction, and there is ST segment elevation myocardial infarction. So this is why when you want to stop, there is you press when you have ventricular fibrillation, a simple way of treatment. You just press your orbit, or you press here. So your heart rate will be returned to a sinus rhythm. Or you make a shock, electric shock. And I'm going to talk about anti-arrhythmic drugs, but the anti-arrhythmic drugs also cause arrhythmias, and that's why people are getting away from anti-arrhythmias, like metoclopramide and so on. And people are moving towards a kind of treatment called radiofrequencing. This is the new thing that people are working on nowadays. When you have calcium, a high calcium in extracellular fluid, your heart will contract very vigorously, and you have a condition called calcium rigor. The ventricles are contracted in systole, and this is called calcium rigor. So, and that's why arrhythmias are very important. And I'm going to talk about the heart as a pump in my coming lecture. Thank you very much.